Video opens with a serious, yet reassuring host in a professional setting, like an office or a studio with medical diagrams in the background. Hello, and welcome to Pancreatic Cancer Warriors. I'm Dr. James, and today we're going to discuss a critical topic that affects millions of people: abdominal pain. Specifically, we're going to act as detectives for our own bodies and learn to distinguish between everyday discomfort and the kind of pain that demands immediate medical attention. We'll break down the specific signals your body might be sending, so you can move from a state of vague worry to one of informed, decisive action. First, let's establish a foundational principle. Not all abdominal pain is created equal. The vast majority of stomach aches, cramps, or feelings of indigestion are temporary and benign. They can result from something you ate, a minor stomach bug, or even stress. These discomforts typically resolve on their own, perhaps with the help of over-the-counter remedies, a bit of rest, or a simple change in diet. However, it's as crucial to understand that a small percentage of these cases can be a signal of something far more serious, like an issue with the pancreas. The key is learning to recognize the patterns and characteristics that separate a minor, transient issue from a persistent, underlying problem that requires you to seek a professional medical consultation without delay. Ignoring these specific signs is a risk you should not be willing to take. This isn't about creating anxiety over every twinge or ache. It's about empowering you with the knowledge to identify when your body is sending a distress signal that truly matters. Our first major area of investigation is the nature and duration of the pain itself. A primary red flag is pain that is persistent. We're not talking about the stomachache that lasts for a few hours after a heavy meal, or the indigestion that bothers you for a day or two. The type of pain we need to be concerned about is one that lingers, lasting for several weeks or even months. It becomes a constant, nagging presence in your life. You might notice that it doesn't respond to the usual interventions. Simple remedies like antacids, dietary changes, or avoiding certain foods don't provide any lasting relief. This is a crucial distinction. Occasional indigestion comes and goes, but pain that sets up residence in your abdomen, becoming a chronic feature of your daily experience, is a significant warning sign. It suggests that the underlying cause is not a simple functional issue, but potentially a more complex structural problem within an organ, and this warrants a thorough investigation by a healthcare professional. Think of it as a low-grade alarm that refuses to be switched off. Your body is telling you that something is consistently wrong, and it's time to listen. Next, we must consider the location of the pain, as this is a major clue in our diagnostic process. The abdomen is a large area, housing many different organs, and where the pain is centered can offer vital information about its origin. For pancreatic issues, the location is often very specific. Be highly concerned about a pain that is situated in your upper abdomen, just below your breastbone. It might feel like a deep, gnawing, or boring sensation. Critically, this pain often doesn't stay in one place. A significant red flag is pain that radiates or seems to bore straight through your body to your mid-back, between your shoulder blades. Many patients describe it as a band of pain that wraps around their upper torso. This specific pattern of radiation is a classic indicator of a problem originating in the pancreas, because of the organ's location deep within the abdomen, close to the spine. Pain from the stomach or gallbladder can also occur in the upper abdomen, but this distinct back radiation feature should immediately elevate your level of concern and point your investigation squarely towards the pancreas. Now, let us add another layer to our detective work, identifying specific triggers that worsen or alleviate the pain. With pancreatic issues, there are classic patterns to watch for. A major warning sign is abdominal pain that is consistently worsened by eating. This occurs because when you eat, your pancreas is stimulated to release digestive enzymes. If a tumor is present, this process can cause increased pressure, inflammation, and irritation, leading to a spike in pain shortly after a meal. This can, in turn, lead to a fear of eating and subsequent weight loss. Another classic sign is pain that intensifies when you are lying flat on your back. The pancreas is located behind the stomach, and when you lie down, other organs can press against it, exacerbating the pain. Conversely, many individuals find that the pain is relieved by leaning forward or curling into a fetal position. This posture helps to take the pressure off the pancreas. If you find yourself instinctively leaning over a chair or needing to sit up and lean forward to get relief from your abdominal pain, especially at night, This is a very specific and concerning sign that strongly suggests a pancreatic origin. This isn't just a random ache. It's a positional pain with clear triggers, and it's a piece of evidence that your doctor needs to hear about. Finally, and most critically, we must talk about the principle of association. While persistent, localized abdominal pain is a significant concern on its own, its urgency escalates dramatically when it is coupled with other specific warning signs. This is the point where a minor concern transforms into an urgent medical priority. If your upper abdominal pain is accompanied by any of the following symptoms, you must seek medical attention immediately. Unexplained weight loss is a major red flag. If you are losing weight without changing your diet or exercise routine, it's a sign that your body is not absorbing nutrients properly or is in a catabolic state, both of which can be caused by pancreatic cancer. Another critical associated symptom is jaundice, which is a yellowing of the skin and the whites of the eyes. This is caused by a blockage of the bile duct, often by a tumor in the head of the pancreas. Also, pay close attention to changes in your stool. The appearance of stools that are pale, clay-colored, oily, or float, and are difficult to flush, is a sign of fat malabsorption, known as staturia, which indicates the pancreas is not producing the necessary enzymes. The combination of abdominal pain with any of these unexplained weight loss, jaundice, oily stools, a new diagnosis of diabetes, or sudden and overwhelming fatigue constitutes a collection of symptoms that must be taken very seriously. This is the complete puzzle, and presenting all of these pieces to your doctor is your most important task. Thank you for joining me today at Pancreatic Cancer Warriors. Remember, being an advocate for your own health starts with being an attentive detective of your own body. Don't dismiss persistent symptoms. I'm Dr. James, and I encourage you to share this information and stay vigilant. Goodbye for now.